Every time I try to think about something, it's like my brain just flips to worry mode. I don't even get why, but every single day, I'm just drowning in this anxiety that won't back off. I try so hard to keep it chill and not go to the dark side of my thoughts, aiming to keep things light and positive, but that just ramps up my anxiety even more. I get all jittery, my heart starts racing like crazy, and I tense up. I get these weird tingles, and my thoughts just start spinning out of control. I picture myself totally messing up, and it's so embarrassing. I try to stop thinking about it all, but my brain won't let me escape. It's like I'm trapped in my own head. Why does this always happen to me? Why can't I just stop worrying? It feels like I'm cursed or something, stuck on this endless loop of negative vibes. Always thinking that everything's going to crash and burn, and I'm just scared all the time. Dealing with this every day, it seriously feels like some bad vibe from my past is haunting me. I don't want to live like this, but it's like my brain won't let me break free. This anxiety stops me from doing stuff, and I hate it so much. But I can't stop freaking out over every little thing. I need help, like really bad. How can I make this stop? Please, just stop. I just want to be happy. But my mind won't let me. I'm so scared this is going to be my life forever. Why is this even happening to me? Someone, please help.
Anxiety disorder is among the top psychiatric disorders in the U.S. 6.8 million adults, or 3.1% of the U.S. population, suffer from anxiety. Anxiety isn't just feeling stressed or worried. It's a normal reaction to stress. But for many, these feelings can be intense, overwhelming, and persistent, affecting daily life. Today, we're going to delve into what anxiety really is. The physiological aspects of anxiety, its symptoms, the thought patterns associated with it, and various approaches to manage it. Let's get started. First of all, what is anxiety? Anxiety is a physiological response to stress. When our minds feel stressed, our stress response kicks in, and our bodies produce stress hormones. 3 hormones are related to the stress response: cortisol, adrenaline, and norepinephrine. Cortisol, often referred to as the primary stress hormone, which is produced in the adrenal glands, and plays a crucial role in various bodily functions, including metabolism regulation and immune response. It helps the body respond to stress by increasing blood sugar levels, enhancing the brain's use of glucose, and increasing the availability of substances that repair tissues. Adrenaline, also known as epinephrine. This hormone is also produced in the adrenal glands and is well known for its role in the body's fight-or-flight response. It increases heart rate, elevates blood pressure, and boosts energy supplies. Norepinephrine, also known as noradrenaline. This substance is similar to adrenaline. Norepinephrine affects parts of the brain where attention and responding actions are controlled. Along with adrenaline, norepinephrine also helps in the fight-or-flight response by increasing heart rate, releasing glucose from energy stores, and increasing blood flow to skeletal muscle. How anxiety affects the brain. In the face of stressful situations, our brain activates a series of physiological and psychological responses that enhance our ability to cope. The amygdala is a key structure within the brain that plays a crucial role in processing emotions, especially fear and anxiety. The amygdala is part of the limbic system, located deep within the temporal lobe of the brain. It constantly scans sensory inputs for signs of danger. When a potential threat is detected, it reacts almost instantaneously by initiating a fear response. The amygdala, responsible for emotional processing, becomes overly active under stress, heightening emotional responses and making an individual more irritable, anxious, and susceptible to mood disorders. Stress often impairs the prefrontal cortex, the brain area responsible for higher-order functions such as decision-making, reasoning, and social interaction. This impairment can manifest as difficulty concentrating, making decisions, and retaining information. Anxiety also can cloud the prefrontal cortex's functionality, leading to challenges in clear thinking, decision-making, and impulse control. Anxiety triggers the amygdala, setting off an alarm that activates the brain's threat response mechanisms. Anxiety heightens the release of neurotransmitters like adrenaline and norepinephrine, which increase alertness. This heightened state, while beneficial in dangerous situations, can be overwhelming in normal settings. The thought process associated with anxiety involves a complex interplay of emotions, cognitive distortions, and heightened physiological responses. Anxiety often distorts the way individuals perceive and react to their environment, leading to a series of thought patterns that can exacerbate feelings of fear and worry. Here's a breakdown of how the thought process typically unfolds in the context of anxiety. Perception of threat. Anxiety typically begins with the perception of a threat, which might be real or imagined. This threat triggers the brain's alarm systems, particularly the amygdala, which is responsible for processing emotional responses. The perceived danger doesn't need to be immediate or physical, it can also be a future-oriented worry about what might go wrong. Worry and rumination. Once a threat is perceived, the anxious mind often engages in worry and rumination. Worry is a way to attempt to mentally problem-solve an issue where the outcome is uncertain but potentially negative. Rumination involves repeatedly thinking about distressing situations or feelings. These thought patterns can create a vicious cycle where the more one worries, the more apparent the threat seems, which in turn increases the anxiety. Cognitive distortions. Anxiety is heavily linked with cognitive distortions. Ways in which our mind convinces us of something that isn't really true. Common distortions include catastrophizing, expecting the worst-case scenario to happen. Overgeneralization, seeing a pattern based upon a single event, or being overly broad in the conclusions we draw. All-or-nothing thinking, viewing situations in only two categories, good or bad, without allowing for any middle ground. Mind reading, assuming you know what others are thinking, usually negatively. Fortune telling, predicting the future negatively without any real evidence. Hyperarousal and hypervigilance. Anxiety can lead to a state of hyperarousal, where the nervous system is in a heightened state of alert. This can cause hypervigilance, an excessive awareness of all environmental stimuli, looking for any possible danger. This often leads to being easily distracted and having difficulty concentrating. Avoidance. The thought process of anxiety often leads to avoidance behaviors. To prevent discomfort, individuals may avoid places, people, or situations they associate with anxiety. While this may provide temporary relief, it often reinforces the anxiety in the long term by not allowing the individual to learn that the feared outcomes may not be as likely or as harmful as they think. Safety behaviors. Safety behaviors are actions taken to avoid experiencing anxiety or to minimize its effects. While these behaviors can sometimes provide a sense of security, they can also maintain anxiety by preventing the individual from facing their fears and realizing that they can cope more effectively than they thought. The entire process often forms a feedback loop. Anxiety leads to distressing thoughts, which trigger more intense emotional responses, further reinforcing the anxiety. Anxiety management. Managing anxiety effectively involves a combination of therapeutic strategies, lifestyle adjustments, and sometimes medication. Here are some comprehensive methods to manage anxiety. Cognitive behavioral therapy, CBT. CBT is one of the most effective treatments for anxiety. CBT stands for Cognitive Behavioral Therapy, a type of psychotherapeutic treatment that helps individuals understand the thoughts and feelings that influence behaviors. It is commonly used to treat a wide range of disorders, including depression, anxiety disorders, panic attacks, and phobias. The fundamental premise of CBT is that our thoughts and perceptions influence our behavior. By changing dysfunctional thoughts, we can change our feelings and behaviors in a more positive direction. Exposure therapy. Exposure therapy is a type of psychological treatment that helps people confront their fears by systematically exposing them to the fear source without any risk, aiming to reduce their anxiety and avoidance behaviors. This approach is effective for treating disorders like phobias, panic disorder, social anxiety, and PTSD, using methods such as direct confrontation, imagination, or virtual reality simulations. Medications. In certain situations, medication can be beneficial, especially for severe anxiety. Antidepressants, specifically SSRIs, selective serotonin reuptake inhibitors, and SNRIs, serotonin and norepinephrine reuptake inhibitors, are often prescribed for long-term management of anxiety. These medications target the amygdala to enhance serotonin levels. Typically, it takes about 6 to 8 weeks for these medications to become fully effective. Common side effects include nausea, dry mouth, insomnia, headaches, and sexual dysfunction. Anxiolytics are medications specifically designed to reduce or alleviate anxiety. These drugs work by influencing neurotransmitters in the brain to decrease abnormal excitement and calm the mind. There are several types of anxiolytics, including benzodiazepines. These are among the most commonly prescribed anxiolytics and are used for short-term relief of severe anxiety. Examples include alprazolam, Xanax, diazepam, Valium, and lorazepam, Ativan. They act quickly, but there is a risk of dependence and tolerance with long-term use. Buspirone. This is another type of anxiolytic that can be used for chronic anxiety. It does not have the sedative and muscle relaxant properties of benzodiazepines, and it typically has a lower risk of dependence. Mindfulness and meditation. These practices involve focusing the mind on the present moment and becoming aware of breathing, thoughts, and bodily sensations to reduce overall anxiety and stress. Mindfulness-based stress reduction, MBSR, and mindfulness-based cognitive therapy, MBCT. Those are structured programs designed to teach mindfulness techniques to help manage stress and improve mental health. MBSR, developed by John Kabat-Zinn at the University of Massachusetts Medical School, focuses on using mindfulness meditation to help people cope with stress, anxiety, depression, and pain. MBCT combines traditional cognitive behavioral therapy, CBT, methods with mindfulness strategies. It was specifically developed to help prevent relapse in individuals who suffer from recurrent depression, blending elements of mindfulness practices and principles with cognitive therapy. Like MBSR, MBCT is typically delivered in a group format over an 8-week period and aims to teach participants how to break away from negative thought patterns that can trigger a downward spiral into depression. Both programs aim to increase awareness and acceptance of moment-to-moment experiences in one's life, which can lead to enhanced well-being and mental health resilience. Guided meditation and deep breathing exercises can also help calm the nervous system. Lifestyle modifications. Simple changes in daily life can also help manage anxiety. Physical activity can reduce anxiety by releasing endorphins and taking your mind off worries. Eating a healthy diet can influence mood and energy levels, reducing symptoms of anxiety. Poor sleep can exacerbate anxiety, so aiming for 7 to 9 hours of quality sleep is crucial. Building a strong network of support through friends, family, or support groups can provide emotional assistance and reduce feelings of isolation associated with anxiety. Stress management techniques. Journaling. Writing down thoughts and feelings can clarify what is causing anxiety and reduce its intensity. Time management. Prioritizing tasks and breaking them into manageable steps can prevent feeling overwhelmed. Progressive muscle relaxation. Gradually tensing and then relaxing different muscle groups can promote overall relaxation. Visualization, imagining a peaceful scene or setting can help divert the mind from anxious thoughts. Remember, while anxiety can feel overwhelming, there are many effective strategies to manage and alleviate it. It's crucial to work with healthcare professionals to develop a treatment plan tailored specifically to your needs. For many people, a balanced approach that includes therapy, lifestyle adjustments, and sometimes medication can significantly improve their quality of life. Don't hesitate to seek help and take that first step towards a more peaceful and controlled life. Thank you for watching, and please consider subscribing for more helpful tips and insights. Until next time, take care of yourself and stay well.